In fact, it's a little bit difficult to answer it in only a few minutes. The reality is that the field of oncohematology has been turned out upside down with the advent of CAR-T. We have a lot of information out there, basically coming from prospective clinical trials in a treatment strategy which is quite complicated from a technical point of view, and that requires quite a lot of knowledge regarding processing since the time that cells are being taken out from the patient and the manufactured product is coming back to the patient. So in this specific setting, real-world data are of special importance. So we need to know if results in the real world are exactly the same than the ones that we have had in pivotal trials. We need to expand the possibility for patients to have access to CAR-T, which is a major issue. We need to decrease the manufacturing process. And because of that, registries, the European registry, the US registry are of special importance. So it's really a kind of a jungle of quite a lot of information that we need to process, and we need to make the best out of it to help our patients as much as possible.